Welcome to your custom deep dive. Today we're cracking open Medical Terminology Demystified.
It's basically your express lane to doctor speak, you know?
We'll be unearthing some surprising medical history
Yeah, and like breaking down those intimidating terms.
so you can confidently decode what they really mean.
Exactly.
I don't know about you, but I'm always curious about those stories behind medical discoveries.
Oh, for sure.
Like, how did they even figure that out?
Right.
You know?
Well, get ready for some fascinating tales.
Yeah.
We'll uncover how a disgraced doctor revolutionized hospital hygiene
That sounds juicy.
and even explore the, shall we say, resourceful
Oh.
methods of early anatomists.
I'm intrigued. Okay.
Let's start with the OG of medicine,
Yeah.
Hippocrates.
Hippocrates.
You know, he's considered the father of modern medicine, but his approach was pretty different from what we're used to today.
In what way?
Well, Hippocrates was a true pioneer.
Okay.
He shifted the focus away from supernatural explanations for illness, instead emphasizing logic and the body's natural healing power.
So instead of blaming evil spirits, he was looking for practical solutions.
Yeah, exactly.
Right.
He believed in supporting the body's own ability to heal.
Okay.
And his go-to treatment was a simple diet of watery gruel
Gruel.
and
Honey.
honey. Okay.
Can you imagine going to the
Okay.
doctor today and getting that
Wow.
prescription?
Yeah, pass.
Right.
Not exactly appealing, but I guess it was a start.
Yeah. I mean, it was a different time, for sure.
What I find really interesting is that some of his observations are still relevant today.
Oh, absolutely.
Like,
His
yeah.
observation that fat persons are more exposed to sudden death than the slender.
Whoa, really?
Yeah.
That's pretty insightful for his time.
Right.
It connects directly to our modern understanding of obesity and heart disease, doesn't it?
It does, yeah.
Wow.
It shows that even thousands of years ago, doctors were recognizing patterns
Yeah.
and trying to understand the link between lifestyle and health.
That's amazing.
Right.
Speaking of understanding the body,
Yeah.
the book also delves into the history of surgery,
Oh, yeah.
which honestly sounds pretty terrifying in ancient times.
You're telling me.
Imagine surgery without anesthesia
Right.
and limited anatomical knowledge.
It's, it's mind-boggling.
Yeah.
The word surgery itself literally means handwork.
Mhm.
And in those days, it was as rough as it sounds.
So how did they even begin to make surgery safer?
Well, the development of ligatures and sutures was a game changer.
Okay.
Ligatures are basically threads used to tie off blood vessels,
Okay.
preventing hemorrhaging during surgery.
Oh, wow.
And sutures are those, seam-like stitches
Yeah.
that reconnect tissues.
So they were figuring out how to control bleeding and put the body back together.
Exactly.
Kind of like advanced sewing, I guess.
You could say that.
That's fascinating.
Yeah.
But there's one figure we can't ignore when discussing the evolution of surgery.
Go on.
John Hunter,
Okay.
often called the father of scientific surgery.
I've heard that name.
Yeah.
The book hinted at his controversial methods.
Yeah.
What's the story there?
Oh, Hunter was brilliant. There's no doubt about that.
Yeah.
He was obsessed with understanding human anatomy.
Hmm.
And he believed the key to better surgery was through autopsies,
Okay.
actually seeing what was going on inside the body.
Makes sense.
Right.
But I'm guessing there weren't a lot of willing volunteers for autopsies back then.
You're catching on
Okay.
to get the corpses he needed for study.
Yeah.
Hunter relied on a network of, shall we say, suppliers?
Suppliers.
Grave robbers, to be exact.
Grave robbers. Wow.
Yeah.
That's dedication to science.
It's a good thing medical ethics have evolved a bit since then.
Yeah, no kidding.
Right.
But Hunter's work, however ethically questionable, did lead to major advancements in surgical knowledge. It's amazing how these early pioneers paved the way for modern medicine,
Yeah.
even if some of their methods were a bit, well, ghoulish.
A little bit.
And this is just the tip of the iceberg.
Right.
Let's move from the operating room to the laboratory
Okay.
and talk about the invention that opened up a whole new world,
Right.
the microscope.
Ah.
Okay, so we're going from grave robbing to the microscopic world.
That's right.
This deep dive is full of surprises.
Get this.
Okay.
The invention of the microscope has a surprising connection to Galileo.
Galileo.
Yeah, the famous astronomer.
The guy who was obsessed with the stars.
That's the one.
What does he have to do with microscopes?
Well, turns out Galileo wasn't just looking up at the heavens.
Mm.
He was also interested in the tiny world.
Really?
The book of nature, as he called it.
Oh, okay.
And believed it was written in characters of geometry.
So he was drawing a parallel between the vastness of space and the intricate structures within us.
Yeah.
That's amazing.
He was one of the early proponents of using lenses to magnify tiny objects.
Okay.
And then there was Anton van Leeuwenhoek,
Right.
a Dutch draper with a passion for lenses who truly revolutionized microbiology.
This guy was like a rock star in the world of tiny things, wasn't he?
He was.
So what did he do?
Leeuwenhoek meticulously crafted his own microscopes.
Wow.
Some capable of magnifying objects over 200 times.
200 times, whoa.
Yeah.
And what did he see with those powerful lenses?
Well, he was the first to observe bacteria,
Oh, no.
yeast, and even red blood cells.
Oh, wow.
He called them animalcules.
Animalcules, okay.
Imagine the wonder of seeing these tiny living creatures for the first time.
It must have been mind-blowing.
Right.
Like discovering a whole new universe hidden within our own.
It was a paradigm shift in our understanding of life.
Yeah.
Suddenly we realized there was a vast unseen world teeming with organisms that impacted our health.
Yeah. In ways we were just beginning to understand.
But not everything in that microscopic world is visible with a regular microscope, right?
That's right.
Like viruses, for example, are incredibly small.
They are, yeah. To visualize viruses, we needed an even more powerful tool, the electron microscope.
Electron microscope.
Yeah.
The book mentioned that electron microscopes use beams of electrons instead of light.
Yeah.
How does that even work?
It's pretty complex.
Okay.
But basically, instead of using light waves, they fire a beam of electrons at the sample.
Oh, okay.
This allows us to see objects that are thousands of times smaller than what's visible with a regular microscope.
So with electron microscopes, we can actually see the detailed structures of viruses and other tiny things.
Exactly.
That's amazing.
We get these incredibly detailed images.
Yeah.
Like topographical maps
Oh, wow.
of cells and viruses. It's like peering into a hidden world.
That was once invisible to us.
Speaking of hidden worlds,
Yeah.
the book also delves into the lymphatic system.
The lymphatic system, yeah.
Which is kind of like our body's internal cleaning crew, right?
It is.
What exactly does it do?
Well, the lymphatic system is this intricate network of vessels and organs that plays a crucial role in immunity, fluid balance, and waste removal.
It's amazing how our bodies have these like intricate systems working behind the scenes to keep us healthy.
All the time, yeah.
So what exactly is lymph?
Think of lymph as this clear fluid that bathes our tissues, collecting waste products, and transporting immune cells throughout the body.
And what about lymph nodes?
Oh, yeah.
I know they're important, but I'm not entirely clear on their role.
Well, lymph nodes are like checkpoints along the lymphatic highway.
Okay.
They filter lymph, trapping foreign invaders like bacteria and viruses.
Okay.
And they house immune cells that launch attacks against these threats.
So it's like a microscopic battleground going on inside us all the time.
In a way, yes.
Wow.
The immune response is this incredibly complex and coordinated process that involves a whole army of specialized cells.
The book mentions the term antigen, which basically means something that triggers an immune response.
Right.
So what exactly is an antigen?
Antigens are like the enemy's uniform.
Okay.
The molecular patterns that identify invaders.
Yeah.
When the immune system detects an antigen, it triggers a cascade of events, including the production of antibodies.
Antibodies, those are like the targeted missiles that seek out and destroy specific invaders.
Right, exactly. They're like the a body's elite forces trained to recognize and neutralize specific threats.
It's incredible how our immune system can adapt and learn.
Yeah.
Developing immunity to diseases we've encountered before.
It is. It's one of the most remarkable features of the human body.
That's amazing.
This adaptive immunity is why vaccines work.
Oh, right.
By exposing the immune system to a weakened or inactivated form of a pathogen. Vaccines prime the body to fight off future infections.
That's a great segue into our next topic.
Yeah.
Decoding medical terms.
Right.
The book emphasizes how understanding the roots of these words can unlock their meaning.
Absolutely.
So it's like we don't have to memorize a million different terms.
Well, it helps to understand the building blocks.
Right.
Many medical terms are built from Greek and Latin roots.
Okay.
Once you know the meaning of these roots, you can often decipher
Yeah.
even the most intimidating medical jargon.
It's like having a secret decoder ring for medical terminology.
Exactly.
I like that analogy.
So, for example, take the term cardiomyopathy.
Okay.
Cardio refers to the heart.
Right.
Myo refers to muscle.
Okay.
And pathy means disease.
Got it.
So cardiomyopathy simply means a disease of the heart muscle.
That makes so much sense.
Right.
It's like a puzzle, fitting the pieces together.
Exactly.
I like it.
Once you get the hang of it,
Yeah.
you'll be surprised how many medical terms you can break down and understand.
This reminds me of something else the book discussed.
Yeah.
The difference between infections and infestations.
Ah, yes.
That's an important distinction, right?
It is.
So what is the difference?
Well, infections are caused by microscopic invaders,
Okay.
like bacteria and viruses,
Okay.
while infestations involve larger organisms,
Okay.
like parasites.
So a bacterial infection is different from, say, a parasitic infestation.
Precisely.
Okay.
The book gave the example of hookworms, which, let me tell you,
Yeah.
are not pleasant.
Hookworms, those sound terrifying.
They can be, yeah.
What are they?
They're these parasitic worms that can burrow into the skin,
Ew.
usually through the feet,
Oh, no.
and travel to the intestines,
Okay.
where they latch on and feed on blood.
Ugh, that's enough to make anyone squirm.
Right.
But it's a good reminder that understanding medical terminology
Yeah.
can help us grasp the different ways our bodies can be affected
Absolutely.
by these invaders.
It helps us understand the nature of the threat
Yeah.
and the appropriate treatment.
Speaking of treatment,
Yeah.
the book also talks about the process of diagnosis.
Diagnosis, right.
Figuring out what's wrong with someone
Yeah.
based on their symptoms and medical history.
Diagnosis is like detective work.
Okay.
It involves piecing together clues from the patient's symptoms,
Yep.
medical history, physical exam,
Okay.
and sometimes laboratory tests
Yeah.
to arrive at the underlying cause
Yeah.
of their illness.
The book mentioned the term prodrome,
Right.
which I found interesting.
Yeah.
What exactly is a prodrome?
A prodrome is like the early warning system of a disease.
Oh.
It refers to the initial,
Yeah.
often subtle, symptoms that
Yeah.
precede the full-blown illness.
So paying attention to those early signs could be crucial for early detection and treatment.
You got it. Okay.
Early detection is often key to better outcomes.
The book also discusses prognosis,
Yes.
which is the doctor's prediction of how a disease is likely to progress.
Right.
So what are the factors that go into a prognosis?
Well, prognosis takes into account factors like the severity of the disease,
Mm-hmm.
the patient's overall health,
Okay.
and the available treatment options.
It can range from optimistic, meaning the outlook is good,
Right.
to pessimistic, meaning the outlook is less favorable.
Exactly.
So it's important for patients and their families to understand the prognosis.
Absolutely.
So they can make informed decisions about treatment and care.
It can be a very helpful guide.
That makes sense.
Yeah.
The book also takes us on a fascinating tour
Right.
of the evolution of diagnostic tools
Yeah.
from symbol instruments.
To cutting-edge technology.
Absolutely.
It's amazing how far we've come from the days when doctors relied on their senses
Right.
and basic tools to diagnose illness.
Imagine that.
Yeah. I mean, I can't imagine trying to diagnose a heart condition without a stethoscope.
No, me neither.
I mean, that...
The invention of the stethoscope by René Laennec in the early 1800s
Yeah.
was a revolutionary moment in medicine.
It allowed doctors to listen to the sounds of the heart and lungs
Yeah.
with much greater clarity,
It changed everything.
leading to more accurate diagnoses.
Absolutely.
And then there's ultrasound,
Ultrasound, yeah.
which uses high-frequency sound waves
Mhm.
to create images of internal organs.
Amazing technology.
Ultrasound is particularly valuable during pregnancy,
Oh, yeah.
allowing doctors to monitor fetal development
Uh-huh.
and identify any potential problems.
Absolutely. It's become a routine part of prenatal care.
It's great.
It's a powerful tool that has transformed prenatal care,
Yeah.
making it safer for both mothers and babies.
This brings us to a tragic chapter in medical history.
Oh, yeah.
Puerperal fever.
Puerperal fever.
The deadly infection
Yes.
that ravaged maternity wards in the 19th century.
It was a nightmare for expectant mothers.
Yeah.
It was a leading cause of death in maternity wards.
Wow.
And doctors were baffled by its cause.
But a doctor named Ignaz
Semmelweis, yeah.
made a groundbreaking discovery that changed everything, didn't he?
He did, yeah.
Semmelweis was a Hungarian physician working in Vienna.
Okay.
He was deeply troubled by the high mortality rates from puerperal fever, and began meticulously investigating its possible causes.
What did he discover?
He noticed that women who gave birth in wards, attended by doctors and medical students who also performed autopsies, had significantly higher rates of puerperal fever.
Wow.
Compared to women who gave birth in wards attended by midwives.
So he suspected a connection between autopsies and the spread of infection.
Exactly.
So what was his theory?
His radical idea was that doctors were unknowingly carrying cadaverous particles, what we now know as bacteria, from the autopsy room to the maternity wards, infecting their patients.
That was a revolutionary concept at the time?
It was, yeah. To test his theory, Semmelweis implemented a strict hand-washing protocol.
Hand-washing?
Yeah.
That's crazy.
Requiring doctors to wash their hands with chlorinated lime solution before examining patients.
And what happened?
The results were dramatic.
Really?
Mortality rates from puerperal fever plummeted in the wards where hand-washing was enforced.
That's incredible. It's a testament to the power of simple yet effective hygiene practices.
Absolutely.
But sadly, Semmelweis's ideas
were met with resistance and ridicule from many in the medical establishment.
It's hard to believe now.
They couldn't accept that their own hands could be spreading disease.
It was a difficult concept for many to grasp at the time.
Yeah.
Tragically, Semmelweis's pioneering work wasn't fully recognized.
Wow.
During his lifetime, he suffered a mental breakdown.
Oh, wow.
And died in an asylum.
Oh, no.
At the young age of 47.
That's a heartbreaking story.
It is.
But thankfully, his legacy lives on.
Yeah.
And his discoveries laid the foundation for modern infection control practices.
Absolutely.
It's a reminder that even the simplest actions can have a profound impact on health and saving lives.
So true.
Speaking of the building blocks of life, our next stop on this deep dive takes us into the fascinating world of cells.
Cells.
Cells are those microscopic units that make up every living thing, right?
They are.
Like tiny factories bustling with activity.
Exactly. Cells are the fundamental units of life. They carry out all the essential functions that keep us alive.
The book talks about how cells are organized into different types of tissues.
Yes.
Each with its own specialized function.
That's right.
So what are the different types of tissues?
Well, we have epithelial tissue,
Okay.
which forms coverings and linings.
Okay.
Connective tissue, which provides support and structure.
Okay.
Muscle tissue,
Yeah.
which enables movement.
Okay.
And nervous tissue,
Oh.
which transmits signals.
So it's like a well-coordinated team
Right.
with each player contributing to the overall success of the body.
Precisely.
And within each cell,
Yeah.
we find a remarkable array of organelles,
Organelle.
each with its own specific role.
They are like the little organs within the cell
Okay.
that carry out specific functions.
The book describes the nucleus as the control center of the cell.
Yeah.
The nucleus,
Containing DNA, the genetic blueprint.
Yes, the nucleus directs all cellular activities, ensuring the cell functions properly.
And then there are ribosomes, the protein factories of the cell.
Ribosomes are essential for protein synthesis.
Okay.
The process of creating proteins from amino acids.
Proteins are the workhorses of the body, aren't they?
They are.
Carrying out a wide range of functions, from building tissues to fighting infections.
Absolutely.
And without ribosomes, our cells wouldn't be able to function.
That's right.
The book also mentions lysosomes.
Lysosomes,
Which act as the cell's recycling center.
They do.
So what do?
Well, lysosomes contain enzymes that break down waste products and cellular debris,
Okay.
keeping the cell clean and tidy.
It's fascinating how our cells have these intricate mechanisms for maintaining order and efficiency.
It's amazing, isn't it?
It is.
It's a testament to the incredible complexity of life at the microscopic level.
And speaking of complexity, let's talk about cell metabolism.
Cell metabolism.
The intricate dance of chemical reactions. That keeps our cells powered up.
Keeps everything running.
Cell metabolism sounds pretty complicated.
It can be,
What's the basic gist?
Well, think of it as the process of converting fuel into energy that the cell can use. Cells need energy to perform all their functions, from dividing and growing to communicating with other cells and transporting molecules.
And what's the primary fuel source for cells?
It's a simple sugar called glucose.
Glucose, Glucose is like the gasoline that powers our cellular engines.
Exactly.
And through a series of complex chemical reactions, glucose is broken down, releasing energy that the cell can use to do its work.
That's how it works.
The book mentions a process called glycolysis. Glycolysis,
What's that all about?
Glycolysis is the first stage in the breakdown of glucose.
Oh, okay.
It's a series of reactions that occur in the cytoplasm.
Okay.
The jelly-like substance that fills the cell.
So glycolysis is like the initial spark.
You could say that.
That ignites the cellular engine.
Yeah. Okay. During glycolysis, glucose is converted into a molecule called pyruvate.
Pyruvate.
Yeah.
And a small amount of energy is released.
Right.
And what happens to pyruvate?
Pyruvate can then enter the mitochondria.
Mitochondria.
The powerhouses of the cell.
I've heard of those.
Where it's further broken down to release more energy.
So the mitochondria are like the cell's power plants.
That's a great analogy.
Generating the energy that fuels all cellular activities.
Yeah. And this intricate process of cell metabolism is constantly humming along, providing the energy we need to think, move, breathe, and simply exist.
It's amazing to think about all these complex processes happening within every cell of our bodies.
It really is.
All the time.
It truly is.
It all highlights the interconnectedness of the human body.
Absolutely.
From the macroscopic level of organs and systems down to the microscopic world of cells and molecules.
That's right.
So we've journeyed from ancient Greece.
We have.
To the microscopic realm.
That's right.
Uncovering fascinating tales of medical history and scientific discovery.
And we're just getting started.
And this is just the beginning.
There's so much more to explore.
There's so much more to explore in the vast and intricate world of medical terminology. Stay tuned as we continue our deep dive, delving into the complexities of the human body.
That's right.
And the language that describes it all.
Absolutely.
Next up, we'll be tackling the skeletal system, muscles and joints.
Get ready to bone up on your anatomy knowledge.
That's a good one. Okay, last time we journeyed from ancient Greece to the microscopic world of cells and those tiny but mighty mitochondria.
Powerhouses of the cell.
Right. Now, let's zoom out a bit.
Okay.
And explore the framework that holds us all together.
Right.
The skeletal system.
The skeletal system,
The skeletal system is much more than just a bunch of bones, right?
Absolutely.
It's a dynamic and living structure.
Yes.
That provides support, protects our organs, and even helps regulate calcium levels.
That's right.
And it's also where we get those cringeworthy bone puns, am I right?
Oh, I can't deny a good bone pun.
Right.
But seriously, the skeletal system is fascinating.
Okay.
It's made up of two main parts. The axial skeleton, which includes the skull, spine, and rib cage. And the appendicular skeleton, which consists of the limbs and the bones that connect them to the axial skeleton.
So the axial skeleton's like the core, the central support structure.
Yeah.
And the appendicular skeleton is like the branches reaching out.
That's a great way to visualize it.
Okay, cool.
The skull protects our brain.
Yeah.
The spine provides support and flexibility. And the rib cage shields our heart and lungs. The appendicular skeleton, on the other hand, gives us the ability to move and interact with the world.
The book mentioned fractures.
Fractures, yeah.
Which are basically broken bones, right?
That's right.
What are some of the key things to know about fractures?
Well, fractures can be caused by a variety of things, from falls and sports injuries
Right.
to car accidents and
Right.
even osteoporosis.
And they can range in severity from hairline cracks
Yeah,
to complete breaks where the bone is snapped in two.
that's right.
And I remember reading about green stick fracture,
Green stick fractures.
which
Yeah.
are more common in kids.
Yeah.
Why is that?
Well, children's bones are more flexible than adult bones, so they're more likely to bend and break incompletely, like a green twig.
That makes sense.
Right.
Now let's move on to muscles.
Yeah.
Engines that power our movements.
Muscles are fascinating. They're made up of specialized cells that can contract, generating force and allowing us to do everything from walking and running to lifting weights and playing the piano.
The book talked about different types of muscle tissue.
Yes.
Can you give us a quick rundown?
Well, we have skeletal muscle,
Okay.
which is responsible for voluntary movements,
Like
raising your hand or kicking a ball.
Okay.
Skeletal muscles are attached to bones by tendons,
Okay.
and when they contract, they pull on the bones,
Okay.
causing movement.
Then there's smooth muscle,
Smooth muscle, yeah.
which lines our internal organs, right?
Exactly. Smooth muscle is responsible for involuntary movements, like the contractions of our digestive system
Yeah.
that move food through our intestines.
Okay.
And then there's cardiac muscle,
Cardiac muscle,
which is found only in the heart.
Okay.
Cardiac muscle is responsible for the rhythmic contractions
Yeah.
that pump blood throughout the body.
It's incredible how our bodies have these different types of muscles,
It is.
each with its own specialized function.
It's a beautiful example of form-following function.
Now, when we talk about injuries related to muscles,
Yeah.
we often hear the terms strain and sprain.
Strain and sprain.
It's easy to get those confused.
It is.
Can you clear up the difference for us?
Well, a muscle strain is an injury to a muscle or tendon,
Okay.
usually caused by overstretching or overuse.
Okay.
A sprain, on the other hand,
Okay.
is an injury to a ligament, the tough bands of tissue that connect bones to each other.
So a strain is a muscle issue and a sprain is a ligament issue.
That's a good way to remember it.
Okay, cool.
Now let's talk about the knee joint,
The knee.
which is often a source of trouble.
Yeah.
It's the largest joint in the body.
Wow.
And it's responsible for supporting our weight and allowing us to walk, run, and jump.
I've heard the knee described as a hinge joint.
Hinge joint, yeah.
What does that mean?
Well, a hinge joint, like the knee, allows movement in only one direction,
Okay.
kind of like the hinge on a door.
Right.
But the knee is more complex than a simple hinge.
Yeah.
It also allows for some rotation and gliding,
Okay.
which gives us more flexibility.
So the knee is both strong and flexible, but that complexity also makes it vulnerable to injury.
Exactly.
Yeah.
The knee is subjected to a lot of stress,
Yeah.
especially during activities like running and jumping.
Yeah.
And because it involves bones, ligaments, tendons, and cartilage,
Right.
there are many structures that can be injured.
What are some of the most common knee injuries?
Well, meniscus tears are quite common,
Okay.
especially in athletes.
Okay.
The menisci are C-shaped pieces of cartilage
Right.
that act as shock absorbers in the knee.
Interesting.
Ligament tears are another common injury.
Okay.
The ACL, anterior cruciate ligament,
Right.
and the MCL,
MCL.
medial collateral ligament, are
Okay.
two ligaments that are frequently injured.
Those injuries often require surgery, don't they?
Well, it depends on the severity of the injury.
Okay.
Some minor tears can heal with rest and physical therapy,
Okay.
but more severe tears often require surgical repair.
It sounds like the knee is a pretty delicate piece of machinery.
It is, yeah.
It's important to take care of our knees to prevent injuries.
Absolutely.
So
Maintaining a healthy weight.
Yeah.
Warming up properly before exercise.
Okay.
And wearing appropriate footwear can all help reduce the risk of knee problems.
Now let's shift gears and talk about the system that keeps our blood pumping.
Okay.
The circulatory system.
The circulatory system.
The circulatory system is essentially a vast network
Yeah.
of highways and roads
Right.
with the heart acting as the central pump
Central pump, yeah.
and blood vessels serving as the transportation routes.
That's right.
And blood is the precious cargo,
The precious carbo.
delivering oxygen and nutrients
Uh-huh.
to every cell in the body.
Exactly. The circulatory system is essential for life.
The book mentioned arteries and veins.
Arteries and veins, right.
What's the difference between the two?
Well, arteries carry oxygen-rich blood away from the heart to the body's tissues.
Okay.
They have thick, muscular walls that can withstand the high pressure of blood being pumped from the heart.
And veins carry oxygen, poor blood back to the heart.
That's right. Veins have thinner walls than arteries.
Okay.
And they rely on valves to prevent blood from flowing backward.
It's fascinating how the circulatory system is designed to ensure that blood flows efficiently in one direction.
It is. It's remarkable.
And the heart is the powerhouse that drives this system.
The heart is amazing.
It's a remarkable organ beating continuously throughout our lives.
It is.
Pumping blood to every nook and cranny of the body.
I know. It's incredible.
The book talked about the different chambers of the heart.
Yeah.
Can you give us a quick anatomy lesson?
The heart has 4 chambers.
Okay.
2 upper chambers called atria.
Atria, okay.
And 2 lower chambers called ventricles.
Ventricles, okay.
The atria receives blood returning to the heart.
Okay.
And the ventricles pump blood out of the heart.
So the atria are like the receiving docks?
Yeah.
And the ventricles are like the shipping departments?
That's a good analogy.
Okay.
And the heart has valves that ensure blood flows in the right direction, preventing backflow.
The book also mentioned 2 different circuits of circulation,
Right.
pulmonary and systemic.
Pulmonary and systemic.
What's the difference?
The pulmonary circulation involves the flow of blood between the heart and the lungs.
Okay.
Deoxygenated blood from the body enters the right atrium of the heart, flows into the right ventricle, and is then pumped to the lungs, where it picks up oxygen.
So the pulmonary circulation is all about replenishing the blood's oxygen supply.
Exactly.
Okay.
And the oxygenated blood then returns to the left atrium of the heart, completing the pulmonary circuit.
And what about the systemic circulation?
Well, the systemic circulation involves the flow of blood between the heart and the rest of the body. Oxygenated blood from the lungs. Enters the left atrium of the heart. Flows into the left ventricle. And is then pumped out to the body's tissues.
So the systemic circulation delivers oxygen and nutrients to all our cells?
That's right. And as the blood delivers oxygen and picks up carbon dioxide and other waste products, it returns to the right atrium of the heart, completing the systemic circuit.
It's incredible how these 2 circuits work together seamlessly.
I know, it's amazing.
To keep our blood flowing. And our cells nourished.
It's a symphony of coordination.
And speaking of pioneers in our understanding of circulation, we can't forget William Harvey.
William Harvey?
A 17th century English physician who made groundbreaking discoveries.
What a figure.
What did Harvey contribute to our knowledge of the circulatory system?
Well, before Harvey, it was widely believed that blood ebbed and flowed in the veins rather than circulating continuously. Harvey's meticulous experiments demonstrated that the heart acts as a pump, propelling blood through the arteries and veins in a closed loop.
So Harvey debunked the old theory.
He did.
And established the foundation for our modern understanding of circulation.
Exactly. His work revolutionized our understanding of how blood flows through the body.
Now let's talk about some key measurements that doctors use to assess cardiovascular health.
All right.
Heart rate and blood pressure.
Heart rate and blood pressure.
Heart rate, also known as pulse, is simply the number of times our heart beats per minute.
That's right.
It's a measure of how fast our heart is pumping to circulate blood throughout the body.
And blood pressure is the force of blood pushing against the walls of our arteries.
Right. So blood pressure is measured as 2 numbers.
Right.
Systolic pressure.
Systolic.
Which is the pressure when the heart beats. And diastolic pressure.
Diastolic.
Which is the pressure when the heart is at rest between beats.
Exactly.
So blood pressure gives us a snapshot of how hard our heart is working. And the health of our arteries.
Exactly. Both heart rate and blood pressure.
Are important vital signs that can provide clues about our overall health.
The book mentioned tachycardia and bradycardia.
Tachycardia and bradycardia.
What do those terms mean?
Well, tachycardia simply means a fast heart rate, usually defined as a A resting heart rate above 100 beats per minute.
Okay.
Bradycardia, on the other hand, means a slow heart rate.
Okay.
Usually defined as a resting heart rate below 60 beats per minute.
So those are just medical terms for a racing heart versus a slow heart.
Yeah, essentially.
But it's important to note that these conditions can be normal in certain situations.
Absolutely.
Like during exercise or sleep.
Right.
However, in other cases, they can be signs of underlying medical conditions.
Yeah, that's right.
And what about high blood pressure?
High blood pressure.
Or hypertension?
Hypertension, yeah.
The book mentioned that it's a serious health concern.
Why is that?
Well, hypertension is often called the silent killer because it may not cause noticeable symptoms in its early stages. However, over time, it can damage our arteries, increasing the risk of heart disease, stroke, and other health problems.
So it's important to get our blood pressure checked regularly, even if we feel fine.
Absolutely. Early detection and treatment of hypertension can significantly reduce the risk of complications.
The book also talked about the coronary arteries.
Coronary arteries,
which supply blood to the heart muscle itself.
The heart needs blood, too, to function.
Why are these arteries so important?
Well, the coronary arteries are like the heart's own personal blood supply lines. They deliver oxygen-rich blood to the heart muscle, which is essential for its proper function.
But these arteries can become blocked, right?
You can.
What happens then?
Well, when plaque, a fatty substance, builds up inside the coronary arteries, it can restrict blood flow to the heart muscle. This condition is called coronary artery disease.
Coronary artery disease?
Or CAD. And CAD can lead to heart attacks when blood flow to the heart muscle is completely blocked. A heart attack occurs. This is a medical emergency that requires immediate attention.
So taking care of our heart health is paramount.
Absolutely.
What are some things we can do to reduce our risk of CAD and other heart problems?
Well, maintaining a healthy weight.
Right.
Eating a heart-healthy diet. Getting regular exercise. Managing stress. And not smoking are all important lifestyle factors that can significantly reduce our risk of heart disease.
Speaking of the stuff that flows through our circulatory system, let's talk about blood.
Blood, okay.
What's it made of?
Blood is more than just a red fluid. It's a complex connective tissue composed of plasma, red blood cells, white blood cells, and platelets.
So it's like a bustling metropolis.
You could say that.
With different players performing specialized roles.
Exactly. Plasma is the liquid component of blood. Making up about 55% of its volume.
Wow.
It's mostly water. But it also contains proteins, electrolytes, nutrients, and waste products.
And red blood cells are the oxygen carriers, right?
Exactly. Red blood cells are packed with a protein called hemoglobin, which binds to oxygen in the lungs and carries it to the body's tissues. White blood cells.
White blood cells
are the immune system's soldiers fighting off infections. And platelets are like tiny first responders rushing to the scene of an injury to help stop bleeding.
They're responsible for blood clotting, right? That's right.
Preventing us from bleeding out from a minor cut.
Exactly. Platelets are amazing. They clump together at the site of an injury, forming a plug that stops blood loss.
It's incredible how all these components of blood,
I know, it's really amazing,
work together seamlessly to keep us alive and healthy.
It's a remarkable symphony of cells and molecules.
And speaking of keeping us alive, let's move on to the system that allows us to breathe. The respiratory system.
The respiratory system.
The respiratory system is all about getting oxygen into our bodies. And getting rid of carbon dioxide,
That's the gist of it. The respiratory system is this intricate network of passageways that allows us to exchange gases with the environment. It starts with the nose and mouth, where we inhale air, and the air travels down the trachea, also known as the windpipe.
Windpipe, The trachea then branches into two bronchs, one leading to each lung. inside the lungs.
Yeah.
The bronchi branch into smaller and smaller tubes called bronchioles.
Bronchioles.
And at the end of the bronchioles are tiny air sacs called alveoli.
Alveoli.
The alveoli are where the magic happens.
Okay.
They're surrounded by tiny blood vessels called capillaries.
Capillary.
And it's here that oxygen from the inhaled air diffuses into the blood.
Okay.
And carbon dioxide from the blood diffuses into the air to be exhaled.
So the alveoli are like the lungs' tiny trading posts.
That's a great analogy.
Exchanging gases between the air and the blood.
Yeah, and this process of gas exchange is happening continuously, ensuring that our cells receive the oxygen they need to function.
The book mentioned choking.
Choking, yeah.
Which is a scary thought.
It is.
What exactly happens when we choke?
Well, choking occurs when the airway becomes blocked, usually by food or a foreign object.
Right.
This blockage prevents air from reaching the lungs, and if it's not dislodged quickly, it can be life-threatening.
So it's a race against time to clear the airway.
Exactly. That's why knowing how to perform the Heimlich maneuver is so important.
The Heimlich maneuver is that technique where you apply abdominal thrusts to force the obstruction out of the airway.
That's right. It's a life-saving technique that everyone should know.
The book also mentioned tracheotomy.
Tracheotomy.
Which sounds like a pretty serious procedure.
It is.
What is it?
Well, a tracheotomy is a surgical procedure where an incision is made in the trachea, creating an alternative airway below a blockage.
So below the blockage.
It's typically performed in emergency situations when the airway is completely obstructed and other methods of clearing it have failed.
It's incredible how doctors can create a new airway.
I know, it's amazing.
It's such a critical situation.
It's a testament to the ingenuity and skill of medical professionals.
Speaking of ingenuity, let's talk about the integumentary system.
Integumentary system.
Which includes our skin, hair, and nails.
It's more than just a pretty facade, isn't it?
It is, yeah.
The integumentary system is our body's first line of defense against the outside world.
Right.
It protects us from injury, infection, and the elements.
And skin is our largest organ, right?
That's right.
It's a remarkable organ, constantly renewing itself.
It is.
And performing a multitude of functions.
It's amazing.
What are some of the key functions of the skin?
Well, the skin acts as a barrier, preventing harmful substances from entering our bodies. It also helps regulate body temperature, keeping us cool when it's hot and warm when it's cold.
Right.
And it's involved in our sense of touch, allowing us to feel textures, temperatures, and pain.
Exactly. The skin is packed with sensory receptors.
It is.
That send signals to the brain, giving us information about the world around us.
That's how we feel things.
The book talked about sebaceous glands.
Sebaceous glands.
And sweat glands.
And sweat glands, right?
What do those do?
Well, sebaceous glands secrete an oily substance called sebum,
oil,
which helps lubricate and waterproof the skin and hair.
Okay.
Sweat glands, on the other hand, produce sweat, which helps cool the body through evaporation.
So sebaceous glands keep us moisturized.
Yeah.
And sweat glands keep us cool.
That's a good way to put it.
Okay, cool.
And these glands are just two examples of the many specialized structures found in the skin.
Now, let's move on to the endocrine system.
The endocrine system.
Which is all about hormones, right?
That's right.
The endocrine system is a network of glands that secrete hormones into the bloodstream.
Exactly.
Hormones are like chemical messengers traveling throughout the body to regulate various bodily functions.
They control everything.
Yeah.
From growth and development to metabolism and reproduction.
The book mentioned the The pituitary gland,
The pituitary gland.
which is often called the master gland.
The master gland.
Why does it have that nickname?
Well, the pituitary gland,
Yeah.
located at the base of the brain,
Okay.
secretes hormones that control the activity of many other endocrine glands. It's like the CEO of the endocrine system,
Okay.
giving orders to the other glands.
And what about the pancreas?
The pancreas. Oh, yeah.
I know it's involved in regulating blood sugar.
The pancreas is a remarkable organ. Okay.
It has both endocrine and exocrine functions.
Okay.
The endocrine function involves secreting hormones such as insulin and glucagon that regulate blood sugar levels.
Right.
Its exocrine function involves secreting digestive enzymes into the small intestine.
So the pancreas is a multitasker, playing roles in both hormone production and digestion.
It is.
That's impressive.
And insulin, produced by the pancreas, is a key hormone in regulating blood sugar. It helps cells absorb glucose from the bloodstream, lowering blood sugar levels.
And what about glucagon?
Glucagon has the opposite effect of insulin.
Okay.
It raises blood sugar levels by stimulating the liver to release stored glucose.
So insulin and glucagon work together to keep blood sugar levels balanced?
That's right. It's a delicate dance of hormones.
Yeah.
That's essential for our health. The book also talked about growth hormone.
Growth hormone.
Which is involved in, well...
Growth hormone, or GH, is produced by the pituitary gland.
Right.
And plays a
crucial role in growth and development.
During childhood and adolescence.
Right.
It stimulates the growth of bones, muscles, and other tissues.
And what happens if there's a deficiency or excess of growth hormone?
GH deficiency can lead to short stature, while excessive GH can cause gigantism.
So growth hormone levels need to be just right for normal growth and development.
Exactly. And speaking of hormonal imbalances, let's talk about diabetes mellitus.
Diabetes mellitus, okay.
A chronic condition that affects millions of people worldwide.
Diabetes is a serious condition that involves problems with blood sugar regulation. Right?
That's right.
What is it exactly?
Diabetes occurs when the pancreas doesn't produce enough insulin, or when the body's cells don't respond properly to insulin.
And this leads to high blood sugar levels.
It does.
Which can damage blood vessels and nerves over time.
That's right. Diabetes can lead to a wide range of complications, including heart disease, stroke, kidney disease, blindness, and nerve damage.
So managing blood sugar levels is crucial for people with diabetes.
Absolutely. This typically involves lifestyle modifications, such as eating a healthy diet, getting regular exercise, and maintaining a healthy weight. Many people with diabetes also need to take medications, such as insulin, to control their blood sugar levels.
The book also mentioned hypoglycemia.
Hypoglycemia.
Which is the opposite of hyperglycemia, right?
That's right.
Low blood sugar instead of high blood sugar.
Yes. Hypoglycemia can occur in people with diabetes who take too much insulin or other blood sugar lowering medications. It can also occur in people without diabetes, but it's less common.
What are the symptoms of hypoglycemia?
Well, symptoms of hypoglycemia can include shakiness, sweating, dizziness, confusion, and even seizures.
Seizures, wow.
It's important to treat hypoglycemia promptly to prevent serious complications.
So if someone is experiencing these symptoms, they should consume something sugary to raise their blood sugar.
Drinking juice or eating candy can quickly raise blood sugar levels. If the person is unconscious or unable to swallow, medical attention should be sought immediately.
It sounds like diabetes is a complex condition that requires careful management.
It is. Wow. But with proper care and monitoring, people with diabetes can live long and healthy lives.
That's good to know.
Now let's delve into the system that controls everything we do. The nervous system.
The nervous system.
The nervous system is like the body's intricate communication network. It's responsible for receiving processing
Okay.
and transmitting information throughout the body, allowing us to sense our surroundings, think, move, and experience emotions.
It's essentially our body's control center.
Exactly.
It's divided into two main parts, right?
That's right.
The central nervous system, which includes the brain and spinal cord, and the peripheral nervous system.
Peripheral nervous system.
Which comprises all the nerves that extend from the brain and spinal cord to the rest of the body.
So the central nervous system is like the headquarters.
Right.
And the peripheral nervous system is like the network of communication lines extending out to all the different departments.
The brain is the ultimate command center, right?
It is.
Processing information from our senses.
Right.
Controlling our movements.
Yeah.
And regulating our bodily functions.
Yes, right.
And the spinal cord acts as the main communication pathway between the brain and the rest of the body.
It carries signals up to the brain and down to the peripheral nerves.
The book mentioned different parts of the brain.
Right.
Can you give us a quick tour?
Sure. The brain is incredibly complex, but let's focus on a few key areas.
Right.
The cerebrum is the largest part of the brain and is responsible for higher level thinking language, memory, and voluntary movement.
So the cerebrum is what makes us, well, human.
You could say that.
What else does it do?
It's what allows us to reason, solve problems, create art, and experience complex emotions.
And what about the cerebellum?
The cerebellum.
I've heard it's involved in coordination.
The cerebellum, located at the back of the brain, is responsible for coordinating movement, balance, and posture. It helps us move smoothly and gracefully.
So it's like the body's choreographer.
That's a great analogy.
Ensuring our movements are fluid and precise.
Exactly.
And then there's the brainstem.
The brainstem.
Which connects the brain to the spinal cord.
That's right. What does it do?
It controls basic life functions. Such as breathing, heart rate, and blood pressure.
So the brainstem is like the life support system, keeping our vital functions running smoothly.
Exactly. Without the brainstem, we wouldn't be able to survive.
Now, within the cerebrum, we have the cerebral cortex.
The cerebral cortex?
The outermost layer. What does it do?
It's responsible for our most complex cognitive functions, including consciousness, thought language, and memory.
The cerebral cortex is like the brain's high-performance processor.
That's a good way to think about it.
Handling our most sophisticated mental tasks.
And different areas of the cerebral cortex are specialized for different functions. For example, the frontal lobes are involved in planning, decision-making, and personality.
And the parietal lobes process sensory information, such as touch, temperature, and pain.
Exactly.
And the temporal lobes are involved in hearing, language comprehension, and memory.
It's amazing how different parts of the brain work together.
I know.
To create our conscious experience.
And speaking of how the brain controls the body, the book mentioned contralateral control.
Contralateral control,
What's that all about?
Well, contralateral control refers to the fact that each hemisphere of the brain controls the opposite side of the body.
Oh, okay.
So the left hemisphere of the brain controls the right side of the body, and vice versa.
Okay.
This crossover happens in the brainstem.
That's why a stroke affecting the left side of the brain can cause a paralysis on the right side of the body.
Exactly. Understanding contralateral control is crucial for interpreting neurological symptoms.
The book also touched on mental disorders. Differentiating between neuroses
and psychoses. Okay.
You explain the difference?
Neuroses are mental disorders that involve anxiety or other emotional distress. But they don't involve a loss of contact with reality. Examples of neuroses include anxiety disorders, phobias, and obsessive-compulsive disorder.
So neuroses are like heightened emotional states that can interfere with daily life.
That's a good way to put it.
Okay.
Psychoses, on the other hand, are more severe mental disorders that involve a loss of contact with reality. People with psychoses may experience hallucinations, delusions, or disorganized thinking.
Schizophrenia is a well-known example of psychosis.
That's right. Psychoses require specialized medical and psychiatric care.
Now, let's talk about the spinal cord, which is essentially an extension of the brain.
The spinal cord, yeah.
What happens if the spinal cord is injured?
Well, a spinal cord injury can be devastating.
Yeah.
It can disrupt communication between the brain and the body, leading to paralysis, loss of sensation, and other problems.
The book mentioned spinal cord transection.
Spinal cord transection.
Which sounds particularly serious.
It is. Spinal cord transection occurs when the spinal cord is completely severed.
Wow.
Cutting off communication between the brain and the body below the level of the injury.
So someone with a spinal cord transection would lose all feeling and movement below the injury.
That's right. It's a life-altering injury that requires extensive rehabilitation and ongoing care.
Now, let's shift gears and talk about our senses.
Okay.
Starting with vision.
Vision.
How does the eye work to allow us to see?
The eye is an amazing organ.
It is.
It works like a camera capturing light and converting it into electrical signals that the brain interprets as images.
So light enters the eye through the pupil.
The pupil.
The black opening in the center of the iris.
Exactly. The iris, the colored part of the eye, controls the size of the pupil, regulating the amount of light entering the eye. The light then passes through the lens, which focuses the light onto the retina, at the back of the eye.
And the retina is where the magic happens, right?
Right.
It contains special cells that convert light into electrical signals.
The retina contains photoreceptor cells called rods and cones.
Rods and cones.
Rods are responsible for black and white vision, while cones are responsible for color vision. And these electrical signals travel from the retina to the brain via the optic nerve.
Optic nerves,
And the brain then interprets these signals,
right,
creating the images we see.
The book mentioned myopia and hyperopia.
Myopia and hyperopia.
Which are basically nearsightedness and farsightedness, right?
That's right.
So what is myopia?
Myopia occurs when the eyeball is too long, or the cornea is too curved, causing light to focus in front of the retina instead of directly on it.
Right.
This makes distant objects appear blurry.
And hyperopia is the opposite.
The opposite, yeah.
The eyeball is too short.
Too short.
Or the cornea is too flat.
Too flat, exactly.
In hyperopia, light focuses behind the retina, making nearby objects appear blurry.
That's right.
And these refractive errors can be corrected with eyeglasses or contact lenses.
Exactly.
Now let's move on to the ear.
The ear, okay.
Our organ of hearing.
Hearing.
How does the ear work to allow us to hear sounds?
The ear is a complex organ with three main parts. The outer ear, the middle ear, and the inner ear. The outer ear is the part we can see, consisting of the pinna, the fleshy part of the ear, and the ear canal.
So sound waves travel through the ear canal to the eardrum.
The eardrum.
A thin membrane that vibrates in response to sound.
And the middle ear contains tiny bones that amplify and transmit these vibrations to the inner ear.
The middle ear contains three tiny bones called the malleus.
The incus and the stage. These bones act like a lever system, amplifying the vibrations from the eardrum.
And the inner ear contains the cochlea.
The cochlea.
Which is the organ of hearing, right?
That's right. The cochlea is a spiral-shaped, fluid-filled structure that contains Hair cells.
Hair cells.
These hair cells are stimulated
Yeah.
by the vibrations from the middle ear,
Okay.
converting them into electrical signals
Okay.
that travel to the brain via the auditory nerve.
Auditory nerve.
And the brain interprets these signals, allowing us to perceive sound.
The book mentioned acute otitis media,
Acute otitis media.
which is a common ear infection,
Right.
especially in children.
Very common in kids.
What's going on in the ear when someone has otitis media?
Well, acute otitis media
Okay.
is an infection of the middle ear,
Okay.
usually caused by bacteria or viruses.
Okay.
It occurs when fluid builds up behind the eardrum, causing pain, pressure,
Yeah.
and often fever.
So it's like having a clogged up middle ear.
That's a good way to think about it.
Okay.
And the fluid buildup can impair hearing.
And otitis media is often treated with antibiotics.
If the infection is caused by bacteria,
Yeah.
antibiotics are usually prescribed.
Yeah.
However, if the infection is viral,
Yeah.
antibiotics won't be effective.
Right.
Now,
Okay.
let's talk about a fascinating language disorder,
Okay.
aphasia.
Aphasia.
Aphasia is a condition that affects a person's ability to communicate.
Right.
It can impair their ability to speak, understand language,
Right.
read,
Mm.
or write.
The book mentioned Broca's area,
Broca's area.
which is a part of the brain involved in language production.
Right.
What happens if Broca's area is damaged?
Damage to Broca's area,
Yeah.
often caused by a stroke,
Okay.
can lead to Broca's aphasia,
Broca's aphasia.
also known as expressive aphasia.
Okay.
People with Broca's aphasia may have difficulty speaking fluently, but their comprehension of language is usually relatively intact.
So they understand what others are saying,
Yeah,
but they struggle to express themselves verbally.
that's right.
Okay.
They may speak in short,
Yeah.
halting phrases,
Okay.
and they may have difficulty finding the right words.
And what about Wernicke's aphasia?
Wernicke's aphasia,
Yeah.
also known as receptive aphasia,
Okay.
is caused by damage to Wernicke's area,
Okay.
another part of the brain involved in language.
So how happens there?
People with Wernicke's aphasia may have difficulty understanding spoken and written language. Their speech may be fluent,
Okay.
but nonsensical.
So they can speak easily,
Right.
but their words may not make sense.
That's right. They may use incorrect words or
Right.
string words together in
Right.
a way that doesn't convey meaning.
Aphasia sounds like a challenging condition to live with.
It can be, yeah.
It can affect a person's ability to work, socialize,
sure.
and maintain relationships.
Speech therapy can often help people with aphasia improve their communication skills.
Now let's take a journey through the digestive system,
Digestive system?
the intricate pathway responsible for breaking down food
Right.
into nutrients our bodies can absorb.
The digestive system is a marvel of engineering.
What is it?
It's a long muscular tube
Mm.
that starts at the mouth
Right.
and ends at the anus.
Okay.
And it includes a variety of organs,
Right.
each with its own specialized function.
It's like a food processing plant breaking down raw materials into usable products.
That's a great analogy.
Okay, so how does it work?
The process of digestion
Yeah.
begins in the mouth,
Okay.
where we chew our food
Yeah.
and mix it with saliva,
Yeah.
which contains enzymes that begin breaking down carbohydrates.
Right.
And the tongue helps propel the food
Yeah.
toward the back of the throat,
Okay.
where it's swallowed.
The food then travels down the esophagus,
Right.
muscular tube that connects the throat
Uh-huh.
to the stomach.
The esophagus is like a chute
Okay.
delivering food
Yep.
to the stomach,
Right.
where the real action begins.
And then what happens?
Well, the stomach
Yeah.
is a muscular sac
Okay.
that churns and mixes food
Hmm.
with gastric juices,
Okay.
which contain hydrochloric acid,
Right.
and enzymes that break down proteins.
So the stomach is like a powerful blender
Yeah,
liquefying food
right.
and preparing it for further digestion.
From the stomach, the partially digested food,
Okay.
now called chyme, enters the small intestine.
Small intestine.
The small intestine is where most of the nutrient absorption takes place. It's a long coiled tube where thyme is mixed with digestive juices from the pancreas and liver.
What do those do?
The pancreas secretes enzymes that break down carbohydrates, proteins, and fats. While the liver produces bile, which helps break down fats. The walls of the small intestine are lined with tiny finger-like projections called villi, which increase the surface area for absorption.
So the villi act like tiny sponges?
That's a good analogy.
Soaking up nutrients from the digested food?
The absorbed nutrients then enter the bloodstream and are transported throughout the body. And what about the large intestine?
A large intestine.
Also known as the colon.
That's there.
The large intestine absorbs water and electrolytes from the remaining indigestible food matter forming feces.
So the large intestine is like the body's waste management system.
You could say that.
Compacting and eliminating waste products.
Feces are then stored in the rectum and eliminated through the anus.
The book mentioned the dangers of acid-base imbalances in the body.
Acid-base imbalances.
What's that all about?
Maintaining a proper acid-base balance in the body is crucial for health. Our blood needs to be slightly alkaline with a pH between 7.35 and 7.45.
And what happens if the pH of our blood gets too acidic? Or too alkaline?
Well, acid-base imbalances can disrupt various physiological processes, leading to a range of symptoms and complications.
The book mentioned metabolic acidosis.
Metabolic acidosis.
And metabolic alkalosis.
Metabolic alkalosis.
Can you explain those conditions?
Well, metabolic acidosis occurs when there's an excess of acid in the body. This can occur for a variety of reasons, such as kidney failure, severe diarrhea, or diabetic ketoacidosis.
And metabolic alkalosis occurs when there's a deficiency of acid in the body?
That's right.
What causes that?
This can occur due to excessive vomiting, overuse of diuretics, or certain hormonal disorders.
So these acid-base imbalances can be caused by a variety of factors.
They can.
And it's important to address the underlying cause to restore a proper acid-base balance.
Absolutely.
Now let's move on to the urinary system.
The urinary system.
Which is responsible for filtering waste products from the blood and producing urine.
The urinary system is essentially our body's filtration system. It removes waste products, excess fluids, and electrolytes from the blood, maintaining a healthy internal environment.
The kidneys are the stars of the urinary system, aren't they?
They are.
Filtering blood and producing urine.
They're like the body's hardworking janitors, removing all the trash and keeping things clean.
Each kidney contains millions of tiny filtering units.
Nephrons.
Which are responsible for removing waste products from the blood.
And regulating fluid and electrolyte balance.
And urine then flows from the kidneys through the
ureters
to the bladder,
where
it's stored until it's eliminated from the body.
Through the urethra.
The urethra.
Yeah.
Okay, now let's talk about the reproductive system.
The reproductive system,
which is essential for the continuation of our species.
That's right. The reproductive system is responsible for producing the gametes, sperm in males and eggs in females. And for supporting the development of a new individual.
Let's start with the male reproductive system. The book highlighted the testes.
The testes.
As the primary organs involved in sperm production.
That's right.
So what do the testes do?
The testes have two main functions. Producing sperm and secreting testosterone.
Testosterone.
The male sex hormone.
And those sperm cells have quite a journey ahead of them, Dawn.